up ko noon yan.
I'm 52 years old.
Yes.
So today, I'm going to assist your heart to a vital sign. Is that okay to you, ma'am?
Yes, okay.
First, prepare all the equipment needed and ensure that they are all in good condition. This facilitates organized assessment and measurement. Provide private. This is necessary to build the trust between patient and healthcare provider. Lastly, perform hand hygiene. This is to reduce the transmission of microorganisms. Temperature. In getting body temperature, help the client assume a position of comfort for axillary temperature. This is to promote relaxation. To take the thermometer out of its holder, turn on the thermometer and place it in the armpit. Placing the device in contact with axillary blood supply can maintain the device in its proper position. Remove the thermometer when it beeps and reads the digital display. This allows accurate temperature reading. Inform your patient about his or her body temperature. Cleanse the thermometer using alcohol swabs before placing it back. This prevents the transmission of pathogens or microorganisms. Place thermometer back at holder and keep securely until its next use. Pulse respiration. In taking the pulse position, the client so that her arms are relaxed and supported. Place fingers, index and middle finger on the inner surface of the wrist, fingertips and sensitive facilitating palpation of pulsating time. Compress artery gently so it can be felt distinctly. This stabilizes rest and allow pressure to be exerted using a watch. With a second hand, count pulsation for 1 full minute. In taking the respiration, keep fingertips in place after counting the pulse. A note of patient's inspiration and expiration. Make sure they do not know you're accounting respiration to avoid control breathing count. Number of respiration for 1 full minute. Lastly, inform the patient and about pulse rate and respiration rate. Blood pressure. In taking the blood pressure, assess patient and assume a correct position. This promotes patient comfort and relaxation. Remove or rearrange clothing to expose the area where the cup will be applied. This is to avoid any disturbance while taking blood pressure. Extend the arms and through the palm, facing upward. Place the cup approximately 1 to 2 inches above the inner aspects of the elbow with a bladder over the brachial and artery. Blood pressure increases when the arm is below level of the heart and decreases when the arm is above the level of the heart. Arrange the manometer gauge at eye level. This is to ensure an accurate reading. Palpate the brachial artery or radial pulse by pressing gently with the fingertips. Tighten the screw valve on the air palm and inflate the cap. While continuing the palpate, the artery, note the point in the gauge where the pulse disappears. Deflate the cap and wait for 15 seconds to prevent leaks during the inflation. Ensure the cap is inflated to a pressure greater than the client's systolic pressure. Place the stethoscope earpiece to the ear properly. The position the dive from the stethoscope firmly but with as little pressure as possible over the artery where the pulse is felt. Do not allow the stethoscope to touch clothing or the cap sound is heard. Place directly over the artery the head of the stethoscope under the edge of the cap. Result of considerable extraneous noise and may cause inaccurate readings. Palm. The pressure through the EMG above the point of which the pulse disappears. Ensure that the cap is inflated to a pressure greater than the patient's. This number as a systolic pressure. Read the pressure to the closest when the number released entirely from the cap of the removed cap from patient and prevent arterial occlusion and patient discomfort from numbness. Disinfect the diaphragm, the stethoscope using alcohol swabs 3 times ensures safety since it prevents cross-contaminations between patients. Next, record temperature, respiratory rate, pulse rate, and blood pressure reading on a flow sheet and indicate the time. Report any abnormal findings. The appropriate person documents the completion of procedure and assessment findings patients. And lastly, perform hand hygiene.